Here's my note card. Hello, my name is Jessica Sturgis. I'm a freshman at UAM, and I'm presenting today a case study over a young adult Jehovah's Witness with severe anemia. An 18-year-old girl that has sickle cell anemia was born to a family of Jehovah's Witnesses. With her family being Jehovah's Witnesses, the medical industry is commonly known for this belief of not receiving any blood transfusions, with the belief and biblical verses of thinking that their blood will become unpure. She has undergone several ICU admissions due to severe acute chest syndrome, which is being caused by the sickle cell anemia, which she is needing multiple transfusions that she would take at the time being. However, shortly after her 18th birthday, she was admitted to the hospital with pain in her lower back, believed to be caused on the onset menstrual cycle she had occurring and unrelieved oral opioid analgesics. Her flow was not heavy for her stay, which lasted 3 to 4 days. Her vitals were beginning to lower the paler she started to get. By the 4th day, she was noted to be very pale with hemoglobin of 3.8 GDL and a relatively poor rectal response of 7.9%. She was transferred to the PICU and consoled on the need for a blood transfusion. She was alert and responsive with tachycardia of rising blood pressure. She expressly refused any transfusions, citing her religious belief that transfusions would deprive her of eternal salvation. She had started on the medications on intravenous iron and darbepoetin. On the next day, her hemoglobin dropped to 3.2 GDLs. Being admitted into the ICU, like I stated previously, the doctors would tell her after this hemoglobin getting so low that this young girl was now at the age to refuse if wanted to. However, she ended up refusing it, even though her parents were still there and they supported whatever she wanted, because it's their belief and these doctors believe this is the only way she could survive, is to undergo transfusions again. The young girl would go on to reject it due to her beliefs. Without transfusions, the doctors believe that would cause severe problems like the risk of cardiac failure, renal failure, and brain damage. After the refusal, they monitored her throughout her stay closely. With blood drawing refusal, they could only complete blood and certain other types of counts every other day. Her hemoglobin improved slightly to 3.6 GDLs with other responses of 14.1%. She received daily physical therapy that was encouraged to emulate. On day 13, she was transferred out of the ICU. By day 17, she was discharged with a hemoglobin of 7.1 DDL on the medications of digoxin, furosemide, folic acid, hydrourine, iron tablets, and labetalol, with a better improvement than what the doctors attended her for. She defeated all those odds.